One of the commonest conditions that affects the aortic valve is a condition called aortic valve stenosis. It's a condition that can remain insidious for a long period of time and then suddenly create symptoms. It's very important to treat this condition because with treatment we can make a big difference to the patient, both in terms of the way they feel and how long they live. Now, traditionally this operation is performed through a breastbone. More recently, surgeons have been performing this operation through what's called a mini stenotomy, where we open a very small portion of the breastbone. And all the published data tells us that patients recover so much quicker with this because they can breathe more easily after the heart surgery, there is less pain and less bleeding. Even more recently, we've been performing the same procedure through something called an anterior right thoracotomy. This is a small cut between the ribs on the right hand side, and the beauty of this over the mini stenotomy is that there is no broken bone, and that heals in 7 or 8 days. Now, there are some hurdles that a patient has to pass to ensure that they're suitable for anterior right thoracotomy aortic valve replacement, but if you're suitable, then you'll recover so much more quickly, more swiftly, with less pain, easier breathing, and quicker discharge from hospital with the anterior right thoracotomy than if we break the breastbone.